Okay, so my presentation today is on industry influence over scientific information on breast cancer, exploring the UCSF industry documents. I want to say that I don't have any conflicts of interest to disclose. So this project got started a little over 2 years ago, and it's been funded by the California Breast Cancer Research Program, and they put out a request for proposals looking for one research team to evaluate the industry documents library for any material related to breast cancer. So as it turns out, of the over 1,000 peer-reviewed publications that have come out of the industry documents library, none of them had looked at breast cancer as an issue. And so the funding proposal, they knew just by typing in the search term breast cancer into the IDL, it returned about 55,000 documents. And they wanted to know, what are these documents about? They wanted to do an exploratory study to see if this material was worth looking into further. So our group here at UCSF got the award, and you can see most of the documents were in the tobacco industry archive, but at the time we just had these 5 archives. There was also some material in the chemical, drug, food, and fossil fuel collections. So our strategy to scope these 55,000 documents, we only had a year. We pulled together a transdisciplinary team, which you can see listed here. We were working with an advocacy partner, Breast Cancer Action, because California Breast Cancer Research Program was largely started by advocacy work, and it was very important to them to include advocates in the work. So we had Breast Cancer Action as a partner. They were involved from the very beginning, forming the research questions, submitting the grant, and participating in the work. And we adopted really an intensive model of engagement throughout the project. So we used traditional tobacco industry documents methods, but we also used a sociological method. I'm a sociologist in training at the moment, called situational analysis. And so we defined situations as external events that might be threatening to these various industries. So we identified, for example, 50 situations that could be deemed as threats. Starting with, on the left in 1969, the US Department of Health, Education, and Welfare Commission on Pesticides and their relationship to environmental health. This mentioned breast cancer, and the industries were concerned about this report. All the way up to a 2017 Environmental Protection Agency Cancer Assessment Review Committee's review of glyphosate toxicity. So about 50 events in between those 2 time periods. And then working together with our group, we narrowed down our areas of focus to 10 topics, starting with smoking, glyphosate, all the way through dietary fat. Some of the key organizations that we found in the documents related to breast cancer: Philip Morris, R.J. Reynolds, Wyeth Ayers, Monsanto, Shell, ExxonMobil, American Petroleum Institute, American Chemistry Council, we've heard about them already today, as well as industry front groups like the American Council on Science and Health and the International Life Sciences Institute. So our strategy was to look at high-level, high-value documents related to these 10 topics to explore further. And I'm just going to share some very high-level results and findings of what we think is in these archives related to breast cancer. And unfortunately, I have to skip over our tobacco findings. But we do have manuscripts in process that hopefully will be submitted at the end of the month and out soon. So I'm going to focus on food, chemical, drug, and fossil fuel. So we had 3 topics that we explored in the food industry documents. So we found almost 600 documents just in the food industry documents archive alone related to fat and breast cancer. So questioning the link between dietary fat and breast cancer. And then when you search across all the archives, there's at least 10,000 documents related to dietary fat and breast cancer. And the material really spans decades of material related to key decision-making events related to the dietary fat and breast cancer link. And the documents really suggest there's a large number of competing interests that have been involved in influencing dietary recommendations related to dietary fat and breast cancer, including food, chemical, fossil fuel, and tobacco industries, and front groups like the American Council on Science and Health as well. So there's so much material to explore there. The next topic related to DDT and breast cancer. So the Food Industry Documents Archive contains at least 102 documents related to DDT, specific to breast cancer, and we looked further into emerging evidence in 1993 that DDT residues were linked to breast cancer. And the documents suggest that the food and chemical industry front groups like the American Council on Science and Health and the International Life Sciences Institute secretly engaged leaders at Mount Sinai Medical School and Harvard to disseminate industry claims that were critical of new evidence linking DDT to breast cancer. And then a third topic related to recombinant bovine somatotropin and breast cancer. So we found that in response to proposed state legislation in the 1990s requiring the labeling of milk from cows who had been treated with this RBST, and the concern was based on evidence of adverse effects of insulin growth factor in breast cancer. So these documents indicate that Monsanto recruited leaders at Mass General and Harvard to testify and submit letters to oppose labeling bills. And Monsanto subsequently donated $100,000 to Harvard's Department of Nutrition. The documents also indicate that the American Council on Science and Health was instrumental in opposing efforts to ban RBST milk in New York. And additional documents in the library also show a longstanding relationship between Monsanto and Harvard's University Department of Nutrition. I guess so. Okay, we can talk about that afterwards. Okay, so moving on to fossil fuel, drug, and chemical industry findings. So on the topic of benzene, found at least 260 documents related to Shell Oil and other industry actors, such as the American Petroleum Institute. We found that they hired a consultant group called Environ Corporation to reanalyze data reviewed in 1984 by the California Department of Health Services to cast doubt on the value of animal models to understanding benzene exposure risk in humans, including mouse models, which demonstrated ovarian and mammary gland tumors. And it appears that Shell and other oil industry actors also attempted to shift blame away from benzene carcinogenesis to overconsumption of dietary fat. The Fossil Fuel Archive also contains some documents indicating that the ExxonMobil Foundation has a history of contributions to at least the Houston chapter of the Susan G. Komen Foundation. And a search for Exxon and breast cancer across all the industry documents collections returns about 938 documents. And then with the drug archive, there's at least 175 documents related to Wyeth Ayerst's communication campaign developed in response to the emerging of evidence in 2002 that their hormonal replacement therapy drug Premarin increased breast cancer risk. And Wyeth Ayerst pursued a public relations strategy to preserve the Premarin market and public confidence in hormonal therapeutics and third-party marketing and communications companies. They hired these companies and recruited them to help them with their strategy. And the strategies included mining existing databases to discover data to generate new publications on Premarin, presenting positive data on Premarin at professional meetings, and targeted promotion to providers specializing in women's health. And then the Chemical Industry Documents Archive we found contains at least 80 documents related to Monsanto's response to the 2015 International Agency for Research on Cancer's systematic review of the carcinogenic potential of glyphosate. This report concluded that it was a probable carcinogen, and there are several studies in the IARC review that evaluated the relationship between breast cancer and glyphosate exposure, and we found that Monsanto partnered with Sustainalytics, which is an environmental, social, and governance risk research group. With this firm, they partnered with them in 2015 to assess the potential damage to its brand name products. So super high level, we didn't delve into the details so much, but definitely a lot of promising material in the archives to be explored related to breast cancer and environmental risks. So another piece of our project, Back to Breast Cancer Action, is they actually worked with advocacy groups that they partner with to share some of our initial findings and get their opinion on how valuable they might be to the work that they do. So Breast Cancer Action did 3 different focus groups, one on tobacco, one on glyphosate and other chemicals, and another on drugs and dietary fat. You can see the organizations that they worked with. And so some of the takeaways from these focus groups after learning of our initial findings was that they felt that there's definitely value in sunshining industry strategies and tactics. That was common across all the groups. They also were more familiar with tobacco and chemical industry tactics, but less familiar with the food and pharmaceutical industry tactics. So some of those were new to them. They also felt that there's a need for training materials to help advocacy groups identify industry tactics, how to evaluate potential partnerships that they're considering, as well as funding sources and sponsorships. There's also an interest from these groups in partnering with academics to customize research efforts that would advance their organizational goals. But additional support is needed. They don't have the capacity to actually do the research themselves in the industry documents library, so these partnerships with researchers is really critical. And then finally, there was an interest in strategic coalition building, which is one of the reasons that we're here today. So that's all I have for you. Thank you very much.